So have we sent the main link to the main group?
Yes, I sent it to the group of the Alliance, the big one.
Okay, wonderful. Yes, Professor, I wanted to say something. On that paper, can we not put better pictures? I was working on that. I just wanted to get you, if it's okay to put nicer pictures.
Nice pictures of
the what do you call this? The paper that you sent on WhatsApp. I can't
the paper
the topic.
when we put the Nakesa as
Yes.
author.
Yeah.
Yeah, I think I will share it with you and we'll discuss it.
Yeah, wonderful. Put better pictures. I was working on that. I just wanted to get you, if it's okay to put nicer pictures.
Yeah. Now, thinks we will put the good pictures. Maybe we have 3 or 2 days. I think we can finalize it by that. Yeah, we still have. Yeah. When we put the Nakesa author.
Yeah.
Share it with you, we'll discuss it.
Yeah, people I think are now coming in one by one. Yeah, this is good.
I sent to you the link of YouTube.
The good pictures, maybe we have. Hello, everyone. I think nice to see all of you. So as I told you, Mr. Kasviti, we will add all pictures and we'll put nice pictures in that paper. So I will share it with you, and to have your comments, I will include it in my report.
بروفيسور صيفط لك لو لينك ديال اليوتيوب.
Merci. So I will also send you the link of YouTube that Mr. Hassan sent us, just for those who are failing to connect. I think it's nice to use also YouTube. It's very practical.
Yes, YouTube has been shared.
Yeah.
And do you think we can start the meeting now?
Yes, yes.
Jacob, you are co-host, so you can accept.
People, yeah.
Hello.
Mr. Hassan, are we
Merci.
recording?
Hello. Hello.
Hi, Ms. Murtala.
Yeah. Oh, good morning. Can you hear me?
Welcome. Yes.
Okay. Yeah. So I'm here now. So.
Hello. Good morning.
Yeah. Oh, Shanta.
Morning.
Glad to be here. Glad to see your face again.
So can we start in 1 minute, Professor Najib,
Yes,
President?
Jacob, you can register the meeting if you want. You are a co-host.
Jacob, I think you can record meeting.
I can record meeting. Thank you. Thank you. So can we start the meeting now?
Okay,
Yes.
YouTube.
Okay. So let us mute our micro while starting the. Bonjour, comment ça va?
Thank you. Welcome, bienvenue, karibu. We'll start with the President's remarks and report. A few minutes, 2 to 5 minutes, we can make our presentations short. Then we move on to the Secretary Shandel. Then we get reports from all the Vice Presidents. Then the finance report from Shandel. Then we get suggestions and contributions from members. Then there will be a election of additional executive committee members, then awards, presentation of our plan for 2021 and closing remarks. So I welcome again, I offer to you, Mr. President, your opening remarks and report for this year. The President is not in the meeting.
He just connected again.
Okay. Mr. Kajiti, can you hear me? Mr. Kajiti, can you hear me?
Mr. Kasviti, he is connected.
He's connected, okay. Can you hear me?
Mr. Kasviti, I think you can hear us.
Maybe you can't hear us. Mr. Kajiti, can you hear me?
Yes, yes.
Okay, thank you. It's now time for you to give your welcome remarks and your speech. Could you please make the speech short, maybe up to 5 minutes, so that all the people listed get a chance to report.
Okay. Well, thank you, Dr. Mgumbati. I see that we only have 10 people so far. Is it because we are still having challenges in terms of connection?
I think it could be because of that, but it could also be because others joining the meeting in WhatsApp.
Okay.
And YouTube, WhatsApp and YouTube.
Okay. Thank you, Mr. Dr. Mkumbate. Firstly, may I acknowledge the Vice President for North Africa, Vice President for East Africa, Southern Africa, the Central Africa, West Africa, and the Secretary General, Madam Chantel Nyamtembo. It is with great honor and privilege that I welcome you all to the first annual report of the Epilepsy Africa Alliance. Africa now more than ever needs its citizens, male, female, and youth and the elderly, to rise to the occasion and develop a homegrown solution to address the many challenges and situations we find ourselves in. The unavailability of affordable medication, lack of health professionals in clinics and in hospitals. In most African countries, it is an issue of great concern. The COVID-19 pandemic has greatly affected our people, and some have passed on. May their soul rest in peace. According to the WHO, estimates epilepsy affects over 10 million people in Africa and in limited and poor resourced health systems across the continent. Stigma, myths, and misconceptions further compound challenges faced by people with epilepsy and their families. The Epilepsy Alliance Africa continues to grow and develop a homegrown solution by harmonizing all the regions of Africa. Professionals, non-professionals, member chapters, and individuals contributing and participating on an equal level. Integration and coordination play a pivotal role of epilepsy programming and key in developing strategies to mobilize resources and implementation for Africa. Creation of broad-based platforms that involve all participants willing to enhance and to improve lives of people with epilepsy in Africa. We have advanced telemedicine and publications. As we move into the future, partnerships will continue to be forged for the greater good for people and Africa at large. Regional bodies in Africa, the African Union, play a significant role in the success stigmatization, mitigation measures, and reducing the treatment gap. The Alliance will continue to develop practical means to capacitate and train professionals and non-professionals. To date, the Alliance has conducted over 20 webinars on various subjects, covering various topics presented by people with epilepsy, professionals, advocates, and non-professionals. The landscape of Africa has changed, and the Alliance will continue to provide technical support and training. Milestones the Alliance has achieved over the last 12 months can only be honored to our partners, men and women of the Alliance like Professor Kisan Najib, Chantel, Dr. Mgumate, Samuel Chikamba, and many others in our executive committee and membership who has supported immensely by hosting webinars, training, and telemedicine. For those that I have omitted, I acknowledge your support to the Epilepsy Alliance Africa. This year, the other highlight was the work of the Alliance. I wish everyone a successful 2021. I thank you and God bless you all. Asante, Messi. Asante sana. Thank you.
Thank you very much, Mr. President, for your speech. We'll now move on to the Secretary General. Unfortunately, the Secretary General is unable to reconnect, so we might need to move on to one of the Vice Presidents. Are you okay to start with your report, Professor Najib? Then we'll move on to Dr.
Yes.
Prince Kasadi.
Yes, so it's my privilege and my honor to give my small report, of course, about North Africa. We have, as you may know, 7 countries. So it's Mauritania, Morocco, Algeria, Tunisia, Libya, and Egypt. So we already have Morocco and we have Libya. Dr. Rabih is already with us in the group. I think she's aware about our meeting. But also I asked from Tunisia, Professor Kamoun, Fatma, she is from Sfax City. She will also join our group. I will send you her phone number. And also from Algeria, we will have Dr. Ben Gamra Noureddin, who is from Oran in East Algeria, and he is in private sector. He is a neurologist. He is willing to join. And also from Egypt, we have 2 colleagues. We have Nermin and Dr. Amani. And already we have Professor Ertidal from Sudan. And from Mauritania, we have Professor Diagana. So I think we will complete all the North Africa, including also Sudan and Mauritania, which are our countries, but I think that will increase our representativity. So about our activities, we have done a lot of meetings and a lot of telemedicine programs. As I mentioned before, I think telemedicine should be our main activity, telemedicine and education. And as I'm a candidate for the IBE treasurer position, so I think we'll also, I hope that it will be successful for me and for all Africans and for the Alliance. I think we will have a representative either from my side and from Manmohan's side as General Secretary. So I think by that time, I think maybe the Alliance will have more important position within IBE. Of course, we'll discuss how the Alliance could be ranked as a high group as a big group and a very productive group in the IBE. So I hope that we can succeed in creating some groups like the Alliance in other parts of the world, like in Latin America, in Asia. I think that will be a very good program. And about the other activities, I think we developed our website. I don't know if you already visited it, so maybe I can share with you the website we developed in. So just when, for example, you click neuromarrakesh.com, I think that's the new website. And now we are putting a lot of leaflets. I think you can see my screen. We are putting a lot of leaflets on the website, and you can also have a look on them. You can also upload the leaflets, and we have one very interesting one shared with the IBE and with other organisms, and it's including all good remarks about epilepsy in Arabic and French. I think that's a very, very useful point. I think it's sharing the screen. So that's another point. The third point, as I mentioned, is the educational program. If you remember, we decided maybe to start the educational program by January or February 2021. So I think if you can see my screen. I think you can see my screen, Jacob and Mr. Torian. I think this is the, for example, if you click on the carnet, so we have a lot of, we have some conferences that we are announcing on the website, and we have here, for example, the leaflet for patients with epilepsy. For example, we are putting it here, and it's very, very practical and very useful. And you can have a lot of, when you click on the leaflet here. I think maybe it's taking some time to upload. So I was talking about the nurse educational program. So that's the leaflet we produce in our association, which is the Tashfin Association. It's in French and Arabic, and it's including all remarks and all guidelines and all useful information for patients with epilepsy. I think here it's the only information you can have. It's in French and English. For example, you can have an introduction, some celebrities with epilepsy, what is epilepsy, what's the cause of epilepsy, and so on. You see, you have a lot of nice pictures. And what is important is it's sort of a compilation of all kind of questions that we had with our patients in the past. So we compiled them in this leaflet, as you may see here. And what is important is we are putting one table, what to do, for example, if you are facing patients with the seizure. For example, here, it's very, very useful. I think that's very useful for our patients. So that's one point. The second point, I think I can maybe share it for just for a few minutes, is the paper we are producing, and which is summarizing all the activities of the Alliance in terms of care, education, and sensitization. So I think it's a paper we produced in Morocco, but we put Salle as first author. And as Mr. Kazviti said, we will improve the paper. You can see here. So I think we are waiting for your inputs and the remarks, and also add your institutions. Of course, we didn't put lots of pictures, but I think we put the main point. You can see here in Africa, all the countries represented. I think we can also add Libya and Sudan at the moment. And we are focusing on these three elements. For example, what we are doing in terms of care. For example, the telemedicine, what we are doing in terms of education, all the webinars we had. I think we had a very, very useful year, despite of the COVID-19 pandemic. And here you can see some pictures, but we can maybe add more pictures. You can just tell us your remarks and your inputs. And here, all the papers published in the African Middle East Epilepsy Journal. And I already shared with you the last issue of 2020, which is including 4 papers from the Alliance, and also one paper from one paper from Manmohan. Okay, so I think that's the main point of my report, and I think we can do lots of other things. And thank you very much.
Thank you very much, Professor Najib, for your report.
Thank you.
We now move on to Vice President for Central Africa, Dr. Prince Kazadi. Please give your report.
Yeah, thank you very much. I'm happy and honored with this report to you. And I'm too happy to see everyone this new year because I missed the last meeting of January. But for my part on our Africa, it is the Central Africa. And the UN take like 9 countries on the Central Africa. There we have Angola, Gabon, Equatorial Guinea, Central African Republic, Democratic Republic of Congo, Sao Tome, Principe, and Chad. But on the year of 2020, also marked by a COVID-19 pandemic, which did not spare Central Africa, which hampered several operations of our institution in various projects and action plans of our Epilepsy Alliance Africa. Despite this description linked to this pandemic, some projects have been carried out by ASLEC Association in Jersey. We have brought within our Epilepsy Alliance Africa, our partners such as the Raw Foundation, the Fighting Epilepsy Foundation, to be able to present in our webinar and to continue to disseminate until now the activity of Epilepsy Alliance Africa in the respective platforms. We connected to 9 countries, members of Epilepsy Alliance Africa, to Indian Epilepsy Foundation with several projects in the near future. We are up now, we are in Central Africa. We bring the CODEF. CODEF is the one foundation of epilepsy in Cameroon, who is able to meet and to work with us in Epilepsy Alliance Africa. The challenge to be met are much more based on the fact of several Central African countries speak French and Portuguese. And this is the permanent barrier to be being able to put all of the countries together. And I hope that, that in this new year of 2021, we will put them strong strategic that which help us, every countries, to meet our alliance in Central Africa. That is why we have one suggestion, because in some countries in Central Africa, we haven't the Association of Epilepsy, and therefore to do, I think for me, my suggestion is to bring like some strategic plan in alliance to help these countries to have like some epilepsies from the association, and this association will be come to meet our Epilepsy Alliance Africa. And I want to give the same report in French, because you know, now we have many countries there with us who speak French. Je suis content de rejoindre tout le monde et vous donner le rapport faisant mention à notre leadership sur l'Afrique centrale en épilepsie. Selon l'ONU, l'Afrique centrale est constituée de pratiquement 9 pays. Et ces 9 pays, nous les citons respectivement. Nous avons l'Angola, le Cameroun, le Gabon, Guinée équatoriale, Afrique centrale, République démocratique du Congo, la République du Congo, Sao Tome, Principe et Tchad. Alors, l'année 2020 a été largement marquée par la pandémie à COVID-19. Et cette histoire n'a pas aussi épargné l'Afrique centrale. Ce qui a fait que nous sommes retrouvés dans un contexte où certains de nos projets ont été entravés, n'ont pas pu être réalisés comme prévu. Et cela, c'est un problème qui a touché pratiquement tout le monde. Et nous aimerions bien améliorer cette façon et cette situation. Et pour ce qui est de l'Afrique centrale, il y a plusieurs pays qui n'ont pas d'association d'épilepsie. Alors, dans ces pays-là, en Afrique centrale, moi, je voudrais qu'on planifie, qu'on ait un plan stratégique pour pouvoir soutenir ces pays, d'avoir au moins une fondation, une association de lutte contre l'épilepsie. Et ceci pourra bien sûr nous aider à avoir plus de membres dans notre alliance d'Afrique pour l'épilepsie. Et je trouve que si nous pouvons faire ça, ça pourra être beaucoup plus bénéfique et nous amènerons tous cette fondation qui seront créées par, bien sûr, l'Epilepsy Alliance et nous les amènerons directement à notre fondation. Alors, c'est ce qui est du rapport de l'Afrique centrale et je vous dis grandement merci. Merci à tout le monde. Thank you very much.
Thank you.
Merci. Thank you. Thank you very much, Dr. Kazad, for your speeches in English as well as in French. Now we move on to Dr. Chams Tensift, who is going to give a report as Vice President for West Africa. Dr. Tensift, please.
Thank you, everyone. I wish to say a Happy New Year to all of those that have met me since the beginning. I'm Dr. Chams Tensift, the Vice President of Africa Epilepsy Alliance for the West Africa. West Africa, Benin, Burkina Faso, Cabo Verde, Ivory Coast, Gambia, Ghana, Guinea-Bissau, Liberia, Mali, Mauritania, Nigeria, Sierra Leone, Senegal. Has been a special year for West African region because throughout the world, the COVID-19 pandemic has spread very quickly, forcing state changes. Patients suffering from epilepsy have been greatly impacted, and they have been exposed to contamination that leads to social distancing and has increased stigma and isolation. State some measures, especially the border closed. There is also a suboptimal follow-up in health centers because of the fear of being infected by the patient and their family. So that makes patients not come.
Sorry, doctor. It seems as if the people speaking, we can't hear what you're saying.
Can you hear me? Can you hear me?
We can hear you, but I think there's noise in the background.
I think, please, for those who are not speaking, I think better to mute your micro, please.
Hello, can you hear me?
Yes, I can hear you.
Okay, I was saying that the West African region have been affected by the COVID-19 as the rest of the world. And that COVID-19 spread very quickly, forcing state and health structure to adapt to new challenges. Patients suffering from epilepsy have been greatly impacted by this new coronavirus. They have been exposed to contamination, and the social distancing has increased stigma and isolation. And some measures taken by the government, like border closure, have limited the access to anti-epileptic drugs, which have been in short supply in some countries. So there were also a suboptimal follow-up in health center because of the fear of being infected by the patients and their families. Despite this difficult climate, association fighting against epilepsy spared no effort to care and socio-professional the living condition of people with epilepsy. So it is in this context that several associations have distinguished themselves, such as Epilepsy Foundation Nigeria, Epilepsy Association of Sierra Leone, Cameroonian League Against Epilepsy, Foundation for Epilepsy, Stigma and Support, Epilepsy Ambassador Initiative, Burkina Faso League Against Epilepsy, and other structures. So we expected more for the new year, for this year, 2021, especially with new
He has muted his mic.
perspective.
Mr. Prince,
Do you hear me? Let's be complete. Hello? Hello?
Mr. Prince, on t'entend.
Yes, we can now hear you.
Hello?
Yeah, we can hear you.
Okay, let's go to the Okay, I was saying that the year 2020 has been a special year for West African region. As for the rest of the world, the COVID-19 pandemic has spread very quickly, forcing state and health to adapt to new challenges. Epilepsy have been greatly impacted by contamination, the social distancing closure, and epileptic drugs, which have been in short supply in some countries. There were also a suboptimal follow-up in health center because of the fear of being infected and by the patient and their families. Despite this difficult climate, association fighting against epilepsy have spared no effort to raise awareness, to advocate for better access to care and fight against stigma and socio-professional isolation, and to improve living conditions of people with epilepsy. In this context, several associations have distinguished themselves, such as Epilepsy Foundation Nigeria, Epilepsy Association Sierra Leone, Cameroonian League Against Epilepsy, Foundation for Epilepsy and Stigma Support, the Epilepsy Ambassador Initiative, Burkina Faso League Against Epilepsy, and others. The year 2021 opens with new perspective in particular, and because of the better knowledge of coronavirus infection and the arrival of several vaccines, we remain hopeful that the pandemic will end soon. And in the meantime, the West African region of Epilepsy Africa Alliance will continue to work to move things forward, particularly with the telemedicine and teletraining program in partnership with all associations. So this is the report for the West African region. I will give a summary in French because most of the countries in West African region are French speaking. Le rapport de l'Afrique de l'Ouest concernant l'Alliance africaine contre l'épilepsie. L'année 2020 a été une année difficile, marquée par la pandémie à coronavirus qui s'est répandue dans tous les pays, y compris les pays de l'Afrique de l'Ouest. Les patients souffrant d'épilepsie ont été grandement affectés parce que non seulement ils ont été exposés au risque de contamination, mais également la distanciation sociale a accru la stigmatisation et l'isolation de ces patients. Certaines mesures, comme la fermeture des frontières, a réduit l'approvisionnement en médicaments anti-épileptiques dans les pays de l'Afrique de l'Ouest. Et certains pays ont nettement souffert de ce manque de médicaments. Malgré ce contexte difficile, beaucoup d'associations se sont démarquées, notamment au Nigeria, au Cameroun, au Burkina Faso, en effort pour continuer à lutter contre la maladie, lutter contre la stigmatisation et améliorer les conditions de vie des patients. Donc l'année 2021 s'ouvre avec de nouvelles perspectives, surtout parce qu'on connaît mieux l'infection à coronavirus et l'arrivée des vaccins contre le coronavirus qui va peut-être contribuer à stopper la pandémie. Donc, nous avons beaucoup d'espoir sur cette année 2021 et nous savons que beaucoup de choses seront réalisées et ont déjà commencé à être réalisées par les associations de lutte contre l'épilepsie en Afrique de l'Ouest. Sur ce, je vous dis merci. Thank you, Osoko, Asante.
Merci. Thank you so much, Vice President for West Africa. Now we move on to the report by the Secretary General. Unfortunately, the Secretary is not able to rejoin the meeting. The next report will be coming from the Vice President for East Africa. Unfortunately, they are joining on YouTube. They are unable to join via Zoom. And the last report was supposed to come from Samuel Chigamba, who's Vice President for Southern Africa. Unfortunately, Samuel was not able to join via Zoom. So I've posted the reports in WhatsApp. If you are in the WhatsApp forum, you'll see the reports of the 3 committee members there. I'm just checking to make sure that they are not in the meeting. Yes, they are not in the meeting. They joined earlier, but they were unable to join again. So we move on to the next part of the AGM, which is the finance report by the treasurer. Our acting treasurer is also the Secretary General, who was unable to join at the meeting. So what I'm going to do now is to share with you the part of our report that is the finance report. So I'll stop sharing now so that I share with you the part of the report that is sorry, I'm still looking for the report. Yes, I got it. Professor Najib, can you please confirm if the report is being shared now on Zoom?
Yes, it's shared.
Yes, I can see.
Yes.
Okay. Okay, thank you very much. So I'll give a summary of this report on behalf of the Secretary General. So the Alliance has received membership fees from the Epilepsy Resource Center in Zimbabwe, that was for 2020, and the association in Rwanda, GECO, for $20, and the Epilepsy Support Association of Uganda, $104, which is membership fee for 2020 to 2024. This gives a total of $144 US dollars. And in terms of expenditure, we did not have any expenditure for 2020. So this is the financial report of the association on behalf of the Secretary General. I will stop sharing my screen now. and also just checking again if any of them was able to join the meeting. It seems they are all not able to join the meeting again. So we are, yes, please go ahead.
Just I have a request, Jacob, about our report. I think now we are in the year 2021. We should start paying the dues for this year. But also, I think we need to find a strategy how to increase our budget and our finances. I think through projects, as I mentioned, I think we have to activate our task force, especially projects. For example, we have one that I will maybe share with you today, and it's including many African countries. I think that could be a very good opportunity to have some money coming from projects and from funding.
Thank you very much. Thank you very much, Professor Najib. Now we move on to the next part of the agenda, which is suggestions from members. So we take your points as suggestions, Professor Najib. Let's have suggestions from other members. Now the secretary is not in the meeting. We need to find someone to write for us. Anyone in the Zoom meeting volunteering to write down comments from members?
Jacob, good morning. It's Anad. I can try. If somebody else takes a note as well, then we can share notes, right?
That's all right. Thank you. Thank you so much.
I'll try. Just before I type, can I just make a comment myself, please? Good morning, everyone. It's just going back to funds, the fundraising. It's obvious that we do need to do fundraising and increase our financial strength. But I think I've noticed on the agenda that one of the points today, one of the reasons for the meeting was also to appoint a fundraiser. But I think we need to really seriously think about doing work in cooperation with each other and connecting as one group, as one continent, to be able to look for funds. So I think if we connect more and plan for 2021 projects and programs that we can do in cooperation with each other, I think that would be a way forward to increase our financial input into the organization. So I just wanted to share that with you guys, and I'll take notes, and if anybody else also take notes, we can share later on.
Can I just make a small comment?
Yes.
I'm really worried with the numbers. We are just about 11. And in terms of the constitution, we should at least have a quorum. I don't know, Professor Najib, can we not resend again the link so that we try to at least have a minimum number of people participating in the Zoom? Yes, people are joined in the WhatsApp and the YouTube, but in terms of key and representation of the vice presidents, it's important that they present and also participate as we deliberate our general meeting, sorry.
Thank you, Professor Najib. Maybe you want to respond on that. There are people who are still not able to join the Zoom meeting, but I'm still sending information to the WhatsApp group because others had already indicated that they won't be able to join because of data limitations.
Okay. I think
Professor
also
Najib.
Professor Najib, I think, is also left.
Oh, he has also left. Okay,
Yeah,
let's hope you'll be able to rejoin. So, Mr. Kachita, are you able to moderate now this section on having comments from the members? There are already comments that have come in, so if we could have more, please. and you could moderate that.
Yeah, okay. So I will be looking at the chat box.
I think if people could just speak, they turn on their mic and they give their points, and Enat will be writing the points as we go.
Okay, thank you. Firstly, maybe for those, so that we are considerate for those that are on YouTube, if you are going to make a comment, if possible, please turn on your mic so that they can see the face, or they can put the voice to the face. So I think now we are open for discussion from what has been presented by the regional vice presidents and even the president himself. So yes, you are open. Any comments? Maybe Mr. Dr. Mkumbate, if there are any comments that are being posted, you could, bring them on board.
Yes, I'll do that. Thank you.
And then I see a comment that meeting in English and French, though there is more English. We are still learning, and we are improving. I think if you remember from the last meetings, it was all in English, but now most of the reports are both in English and in French. And I hope next time we'll go to Portuguese. I see the Secretary General is now here. Madam Chantel, welcome.
Yeah, you're welcome. It was difficult to connect, and thank you so much for attending this meeting.
Very sorry for that. Even myself, I had some challenges, but it came through.
I think the password is ABC. The new password is not working.
Okay. So we were now open to the floor for any comments, but since you are there, will you be able to give your presentation?
Yeah, 1 minute.
Okay.
Okay, until Chantel gets her presentation on the way, can I just ask a question on the agenda item? One of the points that were put there was about awards association of the year. Can somebody explain to me how that was assessed? What was the measure, and what strategies did we use to assess, to come up about that award? Because I'm not sure about that.
Oh, okay. You mean the criteria that was used to select individuals and chapters? Maybe Dr. Mkumbate, could you shed more light?
Yes, I'll be glad to do that. Thank you. So this is our first AGM and also first awards that we are giving out. And the selection was done by the council when we met to deliberate about the AGM. So we considered, the main thing that we considered was payment of dues or a payment of annual fees. Then we also considered participation in activities since we started in December 2019. Not sure if that answers your question in that.
So Jacob, you mean the award is specific? Because what is not clear to me is the award about the participation within the Alliance, or is it the award participation within the work of epilepsy in Africa? So that is not clear to me.
I can answer you. The situation, because all of us as a chapters, we've had affiliation internationally, like the International Bureau for Epilepsy, other are members of the International League Against Epilepsy. So every season we are sharing the activities run by each chapters. For example, if you see what has been done by the chapters of Kenya, the Kawe, include also the Uganda, the Uganda Association, include also the Youth Move. Every season we have advocacy and awareness activities which connect all of us. For example, we can have a way to develop a program with a project, example, the telehealth. We contact the Malawi and we got some nurse and some patient, and we process it through Dr. Najib, and also he came to connect with the telehealth of Rwanda and sort out some boot camp of patients. But we are trying to show activity after activities and share the awareness and advocacy skills, and that make each one committed. So we have we have like a 5 subcommittee. Some are involved in the research. We wrote so many articles published by the East Journal from Dr. Najib. And we do some other research, example, on collaboration of the name, the meaning of the epilepsy. Like yesterday, you saw Jacob on DLA, the Lancashire University, presenting for the exhibition of Dr. Najib. That is an excellent work. We saw also some other commitment, like the way we are trying to involve the Alliance of Africa to work in close collaboration with the social affairs of the African Union. That is the progress which comes step by step. And if you see also ASLEC, which work with Raw Foundation. So we try to share partner even with Raw Foundation, Indo, and we congratulate also the youth Dr. Najib, even Dr. Mercy from Cameroon for sharing other stakeholder with us. Then we know that epilepsy is less funded in Africa. So for us, we need to synergize. Like in Rwanda, it's funded by the Handicap International Humanity Inclusion, but how can I let other countries to know exactly those programs run by the Handicap International? Is for me to alleviate others, to show them the executive of the Handicap International and let them connect to that platform. So that's the way the commitment is raised the reward is raised on commitment, like the great job done by Dr. Najib, even Dr. Jacob Mugambate for setting up the website, the network, include ourselves. So we try to give the award according to the commitment of each individual. Thank you so much.
Thank you, Chantel. The reason I am asking that is just going back to the connection. For example, I am, as much as possible, I'm trying to connect with this organization, and I've had a lot of conversation with Jacob and Chantel and the rest of it. Ethiopia that I represent, we've done amazing work in 2020 and 2021, raising awareness. It's huge work we've done. For the first time entered through the government, the Ministry of Health, to open at least, a neurology kind of bringing epilepsy into service within the government. But I don't have any link to share this. So when I'm saying about, I'm not talking about being specific to a person. So it's just about bringing our work together so everybody knows from, the whole of Africa what is happening. So I guess for the executive group that know each other or know the certain number of people, what is going on, but we don't know. You don't know. Obviously, you haven't known anything about what's happening in Ethiopia. So we have to have some kind of communication where the whole Africa communicates with each other. So, Jacob knows what's happening in Ethiopia. Chantel knows, and all the rest of you know what is happening in each other's country. And I think when it comes out of there is where we get our strength. So I'm a little bit kind of, basically what it is, what can we do in 2021 to improve this, to improve our linkage? Like, for example, Chantel, you said about what's it, International League Against Epilepsy. We have no connection in Ethiopia, and I think last time I've spoke to you about the situation there, nothing has been resolved. So what can we do in 2021 to improve our communication and make all the countries feel that we are part of this organization? Because unless we have that feeling within us, it's not about membership, you know, $100 or $20, whatever, as a member, what we pay is not going to make us grow. It's our spirit of unity and knowing our work is what's going to help us grow. So how are we going to improve that for 2021?
Maybe I could come in on that one. Thank you for raising that important point. One of the issues, in fact, some of the structures and strategies that we have is that each regional the VP coordinates activities from the member chapters within their region. So in your case, I think it should be Kenya. Am I correct?
No, Ethiopia.
Yeah, your regional vice president, your regional, which region are you from? West Africa, eh?
Well, I mean, Ethiopia lies under East Africa, so I don't know who the region of East Africa is. I don't know.
East Africa.
Yeah, I'm assuming, is that where we fit in, Jacob?
Yes. So, okay. So just what I just wanted to explain was that you need to feed into your region, and then from your region it comes to the Secretary General and to the Alliance, and then it's posted on the various platforms. But in any case, I think it's an area where we need to improve. But I think now, since we have taken note of this, there's need now to send most of these things via to the Secretary General. And even you can post those things via the WhatsApp group, that most of the activities are posted by, you know, all members without, you know, going to any specific individual, so that, you know, these things can be recorded. I'm very grateful that you've done a lot of work in your country, and this is what we want to showcase, that we are doing a lot in our various countries, and even in our organizations in your country. We know that maybe there might be more, but let's have this and it's being recorded. But let's also improve coordination between regions, the vice president, here present, please. I think you have heard her. We need you to connect more. You need to talk to each other as chapters so that it feeds into the whole of the alliance. Yes, thank you. I think that the point is noted.
I think she needs, because I add you to the WhatsApp group. Every activity run in your country every month, every season, you need to share the picture of it. And then when we give you example, a task force to write example, an article, just to define a summary of what you have done, you can give it to us. It also help us for publication. So that's maybe the way others can know about your activities run in Ethiopia. And it is the way to connect, yeah, to each members. Thank you.
Okay, right. Okay, all right, that's fine. Thank you.
Thank you very much. I hope you are writing all those issues. I think they are very important issues, communication, and also the issue of selecting associations of the year. I think it's an issue that we also discussed in the executive, and I think it was the president who suggested that going forward, we need a written down policy on selecting members of the year. And we need to advertise that well before the AGM. Of course, we did that, but I agree that we need a clear policy that starts well at the beginning of the year. Thank you. Thank you. Over to you, Mr. President.
Just I apologize because I have been disconnected. We have some Zoom problems this morning. I don't know if there have been any questions for me. If not, now I'm connected.
So far, no, we've just opened the floor to everyone for suggestions before the Secretary General comes in with a report.
Okay, but I think my suggestion is to include more members from not represented countries. I think our goal should be to have maybe each country represented in the 53 countries. Yes. I think we have maybe now 30 or 35. So we still need 20 more countries to be represented.
Yes, I think we also share the same sentiments with Madam Enet from Ethiopia. She also highlighted the same, to increase the numbers, and also the issue of increasing collaboration within regions. And again, she talked about the criteria we are using to select members for awards, be it members or chapters or countries or regions. So I think that has been addressed. I think it's also something we discussed in our last executive meeting, where we need to come up with a clear policy on how do we select people, individuals, organizations, regional regions in terms of awards. And I think that is something we are working on. All right. In summary, that is what we've just discussed whilst you were locked out. So are there any other issues that we feel need to be discussed? Maybe can someone, are there any comments from YouTube or from WhatsApp from people?
Yes, one question from WhatsApp. I just posted it in the chat forum.
Yes, Professor Kesa. You can go ahead.
Maybe to wait for the 12th of the March, which is very close, just to know about.
You're breaking. Maybe could you type the question, maybe, Professor?
There's a problem.
Just a little problem with the micro.
We'll have the.
Yeah, I think his connection is not very good.
Yes, you can continue from the comments.
Yes, there's a comment in the chat. I just sent it to the chat. You can read it from there. It's from Kenneth in the WhatsApp group.
Okay.
I can read it. Great meeting, internet issues. Why does Epilepsy Alliance Africa officials, e.g. president and vice, work only with few associations in countries while sidelining some? So that's a question from the WhatsApp group.
Okay. No, thank you. I think we have an open door policy. Everyone is welcome to become a member of the alliance. And in each region, we have a president, and we expect or anticipate coordination from within each region. Let's take typical example of Southern region, where we have Zimbabwe, Zambia, Malawi, Botswana, Mozambique, South Africa, Namibia. We coordinate each other in terms of awareness or on behalf of the alliance through our Vice President, Mr. Samuel Chikomba from Malawi. So that way, he also tries to coordinate and invite other members. If this is the case, it seems that we are not doing invite as many people from the respective regions. So I'm hoping that this is an opportunity to us all, including myself, to make sure that in each region, all the countries are invited or are at least represented. I think maybe the other vice presidents can comment on this and why other countries are sidelined. Maybe can he be specific, maybe from which region does he come from, so that we make an effort to make sure that they are also, taken on board.
So just to close my idea, I think I said that we have maybe to wait for the 12th of March. We can include other members, but I suggest to wait. Maybe we have now 2 weeks. Then I think we can analyze all the scenarios. Maybe if we will succeed in IBE, I hope so, because we have all chances, me and Manmohan. So by that time, I think we can increase the position of the alliance and maybe make it under the umbrella of IBE. I don't know, what do you think? Or maybe we can change the strategy of IBE to put some alliances inside the IBE. But we should give more power to the groups than to the IBE. So that's my point of view. I think let's put this into account and wait till the 12th of March to know the results. But by that time, I think we have to increase
Professor Najib. You're breaking up, Professor Najib. Musimbi, I see your hand is up. Can you go ahead with your comment?
Yes. So my comment is now that we are waiting for the results for IBE, which will be known on the 12th of March, I think there will be 2 scenarios. I hope so that we will succeed. So by that time, I think we have to collaborate with IBE. We can make the alliance African one, and to increase and to encourage other alliances in the world, in Latin America and Asia. Then we can put all the alliances under high ranking under the umbrella of IBE. Of course, it will be independent, the alliance, but better to collaborate with IBE. I think that's the first scenario. The second one, maybe if I hope that it won't happen, maybe not to succeed in the elections. I think, but that time, I think we have to focus on our alliance, whatever is the future and direction of IBE. But I think by that time, we have to increase the number of countries belonging to the alliance, maybe to have the maximum, and I don't know the criteria. It should be a very active association, people willing to join, to collaborate. And I think we have to be open and to include more members. Thank you.
Sorry,
Thank you, Professor Kisan.
Can I just come in on this one? Professor, I do understand the importance of working in partnership with IBE, but I think I want to reiterate the point that we as an African organization, we need to stand on our own 2 feet first. So IBE is another issue. IBE, I was at the meeting, the Uganda meeting in August, a couple of years ago, and it was, IB is a different thing. Now we're talking about our own alliance, the African alliance, and we need to strengthen that. So I don't think we should be waiting for the other result. That's not the issue. The issue here is exactly what I was mentioning, our brother saying, like other countries feel sidelined. I'm sure no one on purpose, feel like they want to exclude these countries, but it's a matter of communication, and it is a new organization. So, African Alliance is what we make of it. So it's an experience. You guys have done a lot so far that you need to be congratulated for, but it's in 2021, how can we strengthen our own EAE, our alliance? So IBE is another thing. I think it's the alliance that we're talking about. That's my personal feeling.
No, I agree, but just what I want to mean is maybe the IBE, maybe in 2 weeks, it could change, because the executive committee is the president, treasurer, and the general secretary. Because I agree with you before, the IBE was not paying any attention to developing countries, to Africa, Latin America, and Asia. But I think if we will be inside the executive committee, we can change everything. So we can be complementary with the IBE. We will be slaves of IBE or something like this. We'll give our own ideas, and we will benefit from the lot of benefits that could IBE offer. So that's my point
just
of view.
To shed more light, board members and all here present, maybe let me take this opportunity. A few weeks ago, I had in a meeting with the current Vice President for Africa region, Action Amos. And we then came to a conclusion that we need to develop some kind of memorandum of understanding where we try to share specific issues and collaborate on specific issues, but definitely independent. I do appreciate the comments and maybe the synergies, but my thinking is that as we run or as we try to engage IBE, it's always important to strengthen our own capacities and structures, like what have just been highlighted. I've just noted that within the regions, there is not enough strength, there is not enough encouragement to invite individuals, countries, and professionals from those regions to join the alliance. So I think moving forward in 2021, we need to strengthen the regions, and we need to make sure that the vice presidents in those regions are held, to account for the success and challenges that they face within that region, so that we try to maximize on the numbers and their presence in that particular region, so that we have more people participating in the alliance. So definitely we'll go in both ways, but definitely we'll focus more on the alliance itself and strengthening its capacity in Africa.
Let me add something. The way you say we want to strengthen the capacity, to strengthen capacity also, it needs also to have a stakeholder. Because if we are doing, each individual use its own stakeholder regionally. Like you see us, like they are using Grow Foundation money, they use Steve Coates money, etc., even Natalie Defeat, etc. But for the alliance, if we are trying to move forward and be independent, it's for each single individual who attend this AGM meeting to see how we can get a financial stakeholder. The financial stakeholder may be Johnson & Johnson. The financial stakeholder can be also part of the Vigo, like Dr. Najib did, the reward and claim those who do those material to control epilepsy to finance the reward. For example, if we are not making effort on funding a stakeholder, we will be trying to work hard, but other people will take over or work. That's why I'm saying, let all of us concentrate in one task. The task we have to do, yes, we'll share activities region by region, but let all of us find a stakeholder, a good stakeholder who believes this alliance. Thank you.
Thank you, Madam, for that.
Thank you. If you could also allow me to air my views.
You're going to continue.
Yes, thank you. Thank you very much. So what I think is important for the alliance is to believe in ourselves and what we can achieve as Africa. That's very important. We need people to partner with. That's no problem, and that's very important. But let's begin home. Let's start with those organizations that we can work with in our countries and in our region. And for me, the number one organization is the African Union. And as you said earlier, the Secretary General, the African Union, they are ready, they are willing, and they are cooperating with us. And that's an important thing. So we need to start from there, at the African Union as well as other regional organizations. Yes, we need to create partnerships with external stakeholders or organizations outside Africa, but these need to be very fair partnerships. We don't want a partnership that makes us a child. We're not a child, we're an independent organization, we're capable of running things, and I think that's something that we should be very, very proud of. Yes, let's go for partnerships, but we really need to be very careful that we don't come up with partnerships that want to parent us, yet we are adults who know what they want. That's my position, Mr. President. Thank you for the time to speak.
Okay. Thank you, Mr. Mgumbate, for that. I think it summarizes what we've just discussed. Maybe for the purpose of time, may I ask the Secretary General to give her report. Madam Secretary General.
Thank you so much.
I don't know, is it possible if you could turn on your mic for those that are on YouTube to see you?
Yeah, 1 minute.
Thank you.
1 minute. Okay.
I see, whilst you're preparing, I see a question on one. Okay, yeah, you can continue.
Yeah, regarding my presentation, I'm just trying to introduce myself like a person who have got epilepsy in the past and be recovered for that disease. And that's why I'm committing to this organization to also help others. So what I can say exactly, yes, I know the challenge faced by many organizations in Africa, how they are less funded, and it is very hard for them to even have an MOU signed on part of the Ministry of Health to get money and to get assistance. So what I can say, first we need to start this annual general meeting on commemoration of Dr. Zimba, deaf, and Dr. Paul Q. But what we need to do, we need to be united against seizures, and we need to work hard together to fight in this time of the pandemic, to fight against COVID, and to find how we may even fulfill the medical task of those who are affected by seizures in Africa. So regarding our annual general meeting, what I can say, we start this organization from 12 December 2019, and we did a lot of amazing job with the president and the executive team, include other members of this association registered during or starting time, even in the middle of the year, many came. And I need also to thank also Dr. Atanas from Burkina Faso to involve many league of doctors in this platform. I hope all of you saw last week, there'll be like 20 joining, and this is an amazing job. When we are working with professional doctors, we may close the gap in Africa. And with the hard work made by Dr. Jacob, who will give you the summary report about how he negotiated from the social affairs of the African Union, and also with other partners who are trying to link with us as Raw Foundation and Dr. Charlotte Becker from the DLA Africa, Disability Inclusion Africa. I think we are doing a lot of progress by working together. All of that came with a network of all of us, patients with the doctors. What we are trying to eliminate it, we are trying to show that we may be independent in one way or others. Like Sarah sent me, she's an executive, she's a part of the executive team, but she's a vice president of East Africa. But she sent me a message saying that we are still young, we are starting, but the future is very bright. So let's try not to put the negative issues now. We start together, volunteering together, and I think we may get to the right success all together. So another thing I try to say, we have got several webinars from beginning of the year 2020 until the end. And we invited so many excellent people like the president of the ELA, who is Dr. Angeline Kakosi from Uganda. We invited also Professor Emmanuel from Nigeria. Dr. Nirmal from the Indo Foundation is also a chapter of EBE and ELA. And we invited also the Dr. Charlotte Becker from Lancashire University, Laurie Lauren from Raw Foundation. And from her also, we got a link how to apply to get the EEG from the website of the Tele-EE from Steve Cott from England. And I hope all of you have idea how to go through his website, complete the name of your organization, the hospital, and then it is an easy task. When you go through, you may see it easy to fulfill. So if he may call you to give him access of information about your region, it's better to talk to him and you may get an EEG. What I can thank him is about The EEG he has given to the National Committee Coordination of Kenya from Dr. Chengo, who worked with Frederic Beuchi. And I think he has done a lot enough also on behalf of ASLEC through Prince Kazadi in DRC by giving other EEG. And we need to thank those organizations because they are trying to help people. Also from Lori Lauren, we saw that the medical task force she has given to Dr. Kazadi is also enough. We can also try to collaborate well enough with World Foundation in the region where there's no medical supplies. And I hope that many associations need to work in close collaboration with the doctor, because when they supply medication, they need to see that you are working in close collaboration with hospital in your region. They cannot give those medication to an association which doesn't have nurse or doctors. For example, if you see the Association of Uganda also receive task of medical force from Lori Lauren, but they get that, but then the sister who are working with Sarah Nekasi, they are working together, but they are nurse, they are professional. So the way to tackle those issues is for us as association to work in close collaboration with hospital. And also when we wrote article and proof facts in a region and send it in the Ministry of Health and in a partner, then they may act because they saw something with a fact. So another thing I can speak is about also the success of the collaboration. We managed to increase members and registration. But something we have actually, I think we have 28 associations registered and 23 in all countries of Africa. Africa have 54 countries, and we need to increase the number even to 20 to cover all regions of Africa. But by 1 year working together, we have succeeded to attract many countries compared even to the EBE, which has more funds from Band Foundation and other partners they have. But this shows that the determination of us as a youth of Africa and even mature people working in international league against epilepsy will make a difference in the future. We will prove facts, and I think the donors will come and knock on our door to help us. We partner also with other associations, like now many associations are asking to partner with us. Example, the one which created the Alliance of Africa Music from Afropins from Sweden, they agreed to do such partnership with us. I can say like the Middle East Africa Journal done by Dr. Najib also, it is also a partner because now we do many publications with him, and he's a president also. And we encourage people to also have time to write article and share it with Dr. Najib. That attracts more viewer and make us more effective in the future. We build also committee of advocacy, awareness, the subcommittee also for fundraising and research. So all of that is highlighted on the summary reports provided by Dr. Jacob and all vice presidents who also write the summaries. And every member after this meeting may have even 20 minutes to read the report, the annual report. For any comment, you can send it to our email and then we'll reply to you. Another thing is about also we are planning, in case we get a fund, we are planning in future to organize an alliance forum for Africa. And that may come in case we get a good funder, we may do it to elevate our credibility for what we do on behalf of the social affairs of the African Union. So let me give for the next Vice President of West Africa, Dr. Gammasi, to explain about the summary report. Thank you so much. If you have any question, you may ask me. Thank you.
Thank you, Madam Secretary General, for that elaborate report. You touched on issues of collaborations with professionals, collaborations with hospitals, clinics, and health institutions, so that we then improve the service delivered to people with epilepsy. You talked on the associations that are alliance and the countries that we have in the alliance, and you also talked again in partnerships that we are currently working on. Thank you for that. The Vice President had done his presentation. I open this floor for questions for the Secretary General. If there are any questions, clarity or comments.
There is a question in the chat forum. Can we have more information about the EEG?
Yeah, regard the EEG, there is a website, Tele EEG UK. So if you, I may write it to this platform. So,
okay.
So Tele EEG UK, but I'll try to write it properly. Sorry.
Okay. No, thank you. There was also another question.
Yeah, this website belongs to Dr. Steve Coates, is from UK, and we recommend hospital to apply to get those tele EEG. So if you write down, you write the name of your association, you write also the doctors in charge, and then maybe they may reply to you. They have a secretary. For some association, they have already replied to them, but others not yet. It's better because if we get the EEG, all of us, we may get a goodwill to help also the telehealth run by Dr. Najib through this organization. Thank you.
Right. I just need to maybe read some questions and comments that are being read from Sarah. But if we want to incorporate the regions in East Africa, then we will do so. This is from Sarah. And then from Mwale, he says, I would like to see the Epilepsy Alliance Africa outline its main causes, as it was formed to new members and association to bring all of us to speed. I'm Thank you, Mr. Mwale. Basically, the Alliance is a Pan-African organization that tries to consolidate the efforts of all individuals, chapters, and professionals, and people in general that are interested in improving the quality of life of people with epilepsy. You know what the African proverbs say: if you want to go fast, go alone. But if you want to go further, go with many. So the more we are in Africa, the more we can help and support our members. Another comment again, it says Ethiopia is in the Horn of Africa, but I suggest that we expand our regions. Thank you for that. Very true. And we need to strengthen the alliance before we go to IB. I agree with Our Lady. Let's strengthen the alliance. It will allow for us to perform better. And then I agree, we are stronger when we are independent. And then we have another comment which says, we know we are struggling now because we're still very young, but the future is very bright. And response from President, we have an open door. Okay, these are just some of the policy, the comments that we posted. So I think so far, those are some of the comments that I have just read from the WhatsApp group. I don't know, do we have any so far on this or on the YouTube that we can highlight before we move on to the next chapter? And then there's someone says, can I have contacts for Sarah from, yes, Madam Sarah. I think most of the contacts, you can get them through our Secretary General. just send a high-end request. She'll definitely give you. Right. Do we have any other comments?
No other comment from WhatsApp and no comment in YouTube.
Yeah, and then, so if there are no any other issues, can we move to the next on the?
Yes, thank you so much. So can I share my the main slide for today's meeting?
Yes, please.
Okay, so we are on number 6, election of additional executive council members. And we received and deliberated on a nomination of Eplos Musimbi as an executive council, and we agreed on Eplos Musimbi's nomination to join the council. We also asked the members to submit names of other people that could join the committee, especially doctors working with children and people with experience in fundraising. I want to report that we have not received any nominations. So we've got one nomination of Eplos Musimbi today. Over to you, President. Over to you, Mr. President.
I have a question. Hello?
Yes, please go ahead.
Yeah, so what about the yesterday meeting? Did you record it from the Dr. Charlotte Becker? Did you meet some partner who are involved in epilepsy or stuff like art, language?
The meeting was recorded because they were organizing it from their side. They recorded the meeting and they said they will share it on Facebook. So still waiting for the link. As soon as I get it, I'll share it with you.
You share it with us, okay.
Yes. I connected with some few people, but their area of work is disability research in general, not epilepsy.
So they didn't consider epilepsy part of disabilities?
No, they did, and I presented in their workshop that focused on disability, but I'm saying some of the presenters that I communicated with were not presenting on epilepsy, but other conditions.
Okay, no problem.
Yeah. Okay, thank you.
Yes.
If my internet cuts, it can be a problem with my internet because I'm in the region now. I'm not in.
Okay. Thank you. So the point now, Mr. President, is for the meeting to confirm the nomination of Musimbi to join the council.
I do confirm. She's a hard work woman, and I think she has done enough. And all of us, we need to rotate sometime, and someone knows more may come and get positioned. Thank you.
Thank you, Madam Gentil. So, Madam Gentil has seconded Musimbi. Can we have another name to endorse? Okay, I'm endorsing Madam Musimbi. Any comments from others? Hello? Silence means we are in agreement, yeah?
No comment from me. I'm endorsing Musimbi, so she's a hard worker and is committed to epilepsy work, not only from the Alliance side, but epilepsy work in Africa in general.
Yes. So with the powers invested in me, I duly endorse Musimbi as a member of the Executive Council of the Alliance. So ladies and gentlemen, here is an opportunity where we are looking for people that are very are good in resource mobilization, in also neuropediatrics, so to join the executive. So if you are interested, please do communicate, do forward your interests via the Secretary General, and definitely it will be considered in our next board meeting. I also see a comment on WhatsApp from Sarah Nikisa from Uganda. She confirmed she is wonderful. Thank you, madam, for that. Right. So
thank you,
even if you are not, I just wanted to make a small comment. Even if you know you do not fit the spaces that we are looking for, but we know that in your country, in your region, and in your groups, you know people who are very much interested or very good in these areas of resource mobilization and also in Europeans. Please invite them. We want to have as many people as possible from diverse and different places from within the country and from the region. Yes, thank you. You wanted to say something?
Yes, quick one. If you could give Musimbi a chance to give an acceptance speech. She is in the meeting.
Yes. Madam Simbi, welcome.
Thank you so much, Mr. President. For those who don't know me, I'm Epilos Musimbi, working in Kenya in epilepsy care for over 12 years now, and having served under various capacities. I once served as the Secretary of the National Epilepsy Coordination Committee in Kenya, which is an umbrella body of all people working in epilepsy care in Kenya, having started off with the late Professor Kioi as the chairman. I've also worked with an organization where I'm still working called Youth on the Move, Empower Talents with Epilepsy, where we are targeting youth living with epilepsy to empower them in various capacities, including life skills. And we've extended our programs to touch on caregivers and parents, and also to do community outreach programs so that we ensure a holistic approach to nurturing this youth living with epilepsy. Through our organization, we've been able to lobby the government on various aspects of medication. It's still a journey. We've managed to bring together various stakeholders so that we do some programs as a team. And at the moment, I'm serving as the director of this organization. I'm humbled to be considered to join the executive team of the Epilepsy Alliance Africa. I will share my expertise on this forum. I'll give advice where I can. I'm ready to learn from others, and I'm willing to share even with individual organizations in Africa to ensure that Africa speaks with one voice on matters epilepsy, and see how we can forge forward to reduce the stigma, create awareness, bring a lot of scientific and social innovations towards managing matters epilepsy. I'm humbled to have joined the Alliance in July, and I'm glad. I didn't know I'm making impact and people are watching and observing, but I come to realize indeed our efforts here in Kenya and beyond have been realized. I'm also humbled for the opportunity to do 2 presentations on the Alliance for the last webinars, and also courtesy of Dr. Najib, I've been able to write a paper on various innovative approaches used in Kenya to create awareness. And soon we'll be working on the contributions of the late Professor Kioi and see if we can come up with a paper. Thank you so much, team, for having faith in me. I'm ready to learn, and I'm ready to also share and see to it that Epilepsy Alliance Africa brings together all Africans and aliens to speak with one voice and help our communities. Thank you so much.
Thank you, Madam Simbi, for the acceptance speech and for we sincerely hope that we will learn more from your experience in epilepsy. Right. Like I said, ladies and gentlemen, we will then be expecting names for submission from the continent for those that are interested in the vacancies that we've highlighted in the presentation. Right. We move on to the awards. Is that correct, Mr. Ngumbadi? Hello? Hello, are you there? Hello?
Yes, I'm there. Sorry, my sharing didn't work very well. I will try to share again. I will share the screen of those members that were approved by the Executive Council for awards. And if they are there, you could give them a few seconds to give speeches. Okay. I will try to share again. Can you see it now?
Yes, yes, yes.
Okay, okay. So the Association of the Year certificate to Epilepsy Support Association of Uganda for paying their membership fees for 4 years, then commendable work certificate to the associations in Sierra Leone, DRC and Burkina Faso, then upcoming association certificate to the association in Mozambique. Over to you, Mr. President.
Yes, I'm not too sure if we do have a representative. I know that Sarah from Uganda has she logged on, or she has not been able to log on?
She's on YouTube.
Okay. Or maybe you could do a voice note on WhatsApp, Madam Sarah, and then we could play it. Then we could play it on YouTube or on the Zoom. And then we have the DRC, Sierra Leone, and Burkina Faso. Dr. Kazed. Or Sierra Leone, whoever is able to go first. Burkina Faso.
Mozambique just lost his connection because of power cuts. He said he'll join as soon as power is restored.
Okay. Dr. Kazad.
Dr. Kazad was in the meeting, is probably dropped. Yes, I can. Yeah, he's there. Yeah, he's connected.
Maybe we could have someone else. Oh, yeah. Yes,
yes.
My Vice President.
Yes, Abby.
Yes, please could you give us an acceptance speech for the award on commendable work you have been doing in the Congo?
Okay. Thank you very much. Thank you very much for that. And I think
you can do both English and French.
What do you say, please?
Yeah, you can go ahead. I said you can do English and then French.
Yes, no problem. No problem for that. Je suis Dr. Prince Kazadi, the Vice President of Epilepsy Alliance Africa. And I think nous pouvons bien travailler ensemble dans cette histoire. Et comme nous l'avons dit précédemment avec plusieurs intervenants, nous avons amené au sein de l'Alliance plusieurs autres organisations internationales afin d'évoluer comme nous trouvons dans l'International Bureau for Epilepsy. Et nous aimerions bien amener aussi nos partenaires au sein des de l'Alliance. C'est ce qui va beaucoup plus nous faire évoluer tel que il dit. Je suis très content que for the Secretary, General Secretary Chantal to share this experience, because myself, I'm already working with the teleity in my clinic. That is very profitable because they are giving us some time. It's like a telemedicine. When you share with them your ED test, you share, and you in a very short time you can get things like ED interpretation, and it is something we can do with Professor Najib. That is too, he's helping us a lot when we want to share some things, like to have many results for one patient. We are trying to share things like this. I think in working in this way, we'll put up our Alliance Africa for Epilepsy. Thank you very much once again. And to give a hand in the hand, we'll do more, and we will bring our Alliance day up, because we have to work in Africa. It is one organization, one organization for African, and we are to put all our strong to bring our alliance very up. Et c'est ce que je disais en français, qu'on peut ramener aussi notre fondation en travaillant ensemble, main dans la main. Encore une fois, merci beaucoup. Thank you very much to all of you. Thank you, President. Thank you, our committee, and we will continue to work together in this way. Thank you.
Thank you, Dr. Kazadi, for the acceptance speech and for the good work that you continue to do in the Congo, and also the partnership you are having with Rwanda, which is quite commendable. Do we have anyone from Burkina Faso? Maybe they're on YouTube or WhatsApp. You could just send your message, and we could try and read it here for you. Anyone else? Yes, Dr. Mugumbate, can we move to the next?
Yes. Just trying to respond to Dr. Watila is unable to join the meeting. Is the passcode ABC123?
I think it was ABC. I don't
yes,
know.
I think
I've got a message from Isao, accepts and appreciates the fact that she was given a chance to work for the region. This is from Sarah. We are proud to be part of the Epilepsy Alliance Africa, and can I send my appreciation in the email after the meeting? And they are very grateful. So it will be formally sent, and I think it will be adopted into our minutes or in the reports of the AGM. I think, Madam Aneta, you have noted that the letter will be sent via email. Thank you, Madam Sarah.
Thank you. Can I share the final item now for the AGM?
Yes.
Yes.
I just shared that. I shared my screen. So it's about the Epilepsy Alliance plan for 2021. It's saying 2020 there. It's a mistake there. My apologies. It should be 2021. So it's divided in 2 months, but also the activities that we do as an alliance on a day-to-day basis. You can see application for funding is there, then attending events organized by partners and members and creating awareness. Then on a weekly basis, we also do a free telehealth clinic organized by Dr. Najib in Morocco. That's free treatment on Wednesday. Then we also work on our social media pages for awareness. And then monthly, we do our executive meetings. We also do the e-training health workers. Dr. Najib is leading that one. And we also do monthly webinars and a monthly newsletter. In January this year, we planned to do a webinar hosted by Morocco that happened, and the AGM. We're not able to do the AGM, and we're doing the AGM now. Then in February, we had a webinar that was hosted by Kenya. Then we also put in place plans to meet the African Union. That did not happen because of the people in the African Union that were supposed to meet, they were on annual leave. Then in March, which is the following month, we've got a webinar organized by the DRC, working with Defeating Epilepsy Foundation in the USA. Then in April, there's a webinar hosted by Rwanda. Then in May, there's an Africa Day webinar hosted by Ethiopia. Then in June, we've got the Epilepsy Alliance Africa Annual Conference. The secretary talked about this earlier. Then we also have a report that talks about epilepsy in Africa in general. Then in July, a webinar, but we don't have a host yet. So we're looking for a country to host the webinar in July and August. Then in September, it will be hosted by Zimbabwe. October, it will be Malawi. Then in November, we'll do our annual general meeting and second anniversary celebrations. There's also Disability Day in November. Then we also need a host for the webinar in December. So in short, this is our program for 2021. I'll hand over to you, President, to moderate any suggestions, comments, and questions from members.
Thank you very much, Jacob. I think it's very, very interesting program.
Thank you.
So I think for our educational program for nurses, I think we discussed to start it in January. Now we are in February. I don't know, maybe in 2 weeks, maybe we can schedule the first meeting. I think now I'm using this occasion because we have a lot of colleagues connected and also by YouTube. I think it will be very interesting to maybe to plan the date. I don't know, Friday. We can, for example, make it in 2 weeks. Or maybe we can make it on Friday, 5th of Friday, 5th March. I think that could be just general meeting with all nurses and to discuss about this educational program and also to try to include the big number of speakers. For example, from India, from Pakistan, we have also Arif, Manmohan and Lilia, and of course, many colleagues from Africa.
Thank you, Professor Najib. I think the plan is not cast in stone, so there could be additions and maybe adjustments. And maybe I would ask Madam Anat if possibly they could host the one of the Zoom meeting, if that is possible. But I think there are a lot of things that we could add onto this work plan. Maybe the second one from Professor Najib is, could we also add something on strengthening the capacity for regions and increasing members from each region so that we address some of the challenges that have been raised by members here. I open the floor for comments and suggestions.
Very strong team. So I think they can be carrying on one of the webinars. Mrs. Atida with us in the group. So we'll discuss with her and let you know.
Okay, that's wonderful. Any other issues or additions to the 2021 program?
Can I just pose a question? In last year, we did our first conference. It went on very well. I think we had about 51 people attending. Are there any ideas or suggestions about how we could increase attendance and support for our second conference this year.
Okay. Sorry, I've just received that they said the YouTube is not working. Could you confirm that, Professor Najib?
Yes, I tried also to use YouTube, but I think there are some problems. I think Mr. Hassan will try to solve this out, because he's responsible of this YouTube and the Zoom links. And about this conference, I had one meeting with one colleague from Turkey. She's the president of the Turkish Association. And I think Turkey is quite advanced in terms of education and managing epilepsy. I think we can maybe make like the webinar we organized between Latin America, Africa, and Asia. Let's make it now, by example, between Latin America, Africa, of course, the Alliance, Asia, and maybe to include some European countries. I think that will be a worldwide conference, maybe on the World Epilepsy Day. I already discussed
Worldwide
with the
Epilepsy Conference.
She's okay.
Sorry,
Can
I just come in here? I'm confused. Sorry, maybe it's me. Which conference are we talking about? I'm sorry.
If I can come in, that's the That's the conference of the Alliance. Our first one was last year. We titled it High Level Dialogue on Epilepsy, but that was our first conference towards August last year. And this year we'll be organizing another one towards the mid of the year. And that's the conference we are talking about. It's the second conference of the Epilepsy Alliance Africa.
Okay, right.
Maybe, Madam Annette, it's more like a big endeavor where we just call everyone to participate and then focus on a particular topic. But at the end of the day, it focuses more on strengthening the capacity and the networking that we've been talking about, and even to showcase who we are and the capacity and the capabilities we have when we find ourselves as Africans. So it's one of the platforms that we use to engage and interlink with other local, continental, and international organizations.
Okay, great, thank you.
Okay. I didn't hear you commenting when I suggested, would you be able to host one of the webinars?
Oh, I am already hosting the May. Yeah, I'm already hosting the May webinar, and I'm happy to help out with the conference as well. I've got experience doing that nationally and internationally, so I'm more than happy to help.
Ah, wonderful. Thank you for that. Thank you. Thank you. Any additions on the 2021 work plan?
Just to add that the suggestion to have an inter-regional meeting or a webinar, it's a very good thing that we should promote. The last one worked very well, so a very good suggestion from Dr. Najib. And Ethiopia, yes, they have applied to host the webinar in May. And that's work that is already ongoing. And yeah, we should encourage others to do the same. And thanks, Annette, too, for volunteering to assist with the conference. We need more people to run around to make the second conference a success. Thanks again.
Just to also share, Dr. Watila just said that he's not able to connect. But Dr. Watila, what you can do is you could send your comments via WhatsApp. We'll read them like what you've just done. Don't worry, I'll just continue watching on YouTube. So it seems I won't be able to participate well enough. Please, you can write your comments and then we'll read them from this end. Maybe because just in case We might lose Mr. Rogerio. Please, could you give your acceptance since you are now back, and then we'll continue with the plenary. Mr. Rogerio Manjeta.
Hello, good afternoon, everybody. My name is Rogerio Manjati from Mozambique. I'm the founder of, thank you very much. I'm the founder of AMAPI. AMAPI is the association, support association of epilepsy in Mozambique. It's a newly formed association working from 2019. I used to work as the national coordinator for an association for children with disabilities in Mozambique. And then I also worked for the World Bank as a consultant, a local consultant. And that's when I came close to the epilepsy issues in Mozambique after doing a job with the World Bank. And that's when I decided, no, I think in Mozambique, we should do something about epilepsy, as we did not have any association dealing with epilepsy in Mozambique. So right now, we are working closely with the Ministry of Health and also with some professionals in the health sector. And yeah, we decided to form this association so that we can support people with epilepsy, and also joining also the Epilepsy Alliance, Africa Alliance, so that we can be part of this platform. So we are very happy to be part of this platform, and we are part of the executive committee in the Epilepsy Africa Alliance. So we are also happy to receive this certificate as Mozambique, as the country that is helping people with disability. So thank you very much.
Thank you, Mr. Jerry. How do you say in Portuguese? Thank you.
Obrigado. We say obrigado.
Obrigado. Thank you. Right. I think thank you for your presentation. And Mozambique is the one of the upcoming association that received the certificates under that category. Thank you and welcome. Back to our plenary for discussion on the 2021 work plan. I wanted also to comment on the issue of COVID-19 or the new normal. In Zimbabwe, we've received about 200,000 vaccines for the frontline health workers, but part of the people that are eligible, people that can be vaccinated, it says that people with the underlying conditions, of which it's not mentioned as epilepsy, but other conditions are not fit to receive. So can we not put something on awareness and education, or even to an extent of research on COVID-19 and the vaccine vis-a-vis epilepsy? This is something that I've been thinking a lot, and a lot of people continue to ask questions. Should we get this vaccine or should we not get this vaccine? And will it not affect my epilepsy or affect the interaction between my anti-epileptic medication and the vaccine? I don't know, but definitely we need to come up with a way in which, we can answer some of these questions. Any comments? No suggestions?
No comment. No.
Najib?
No comment from me, but it's an important topic that we should explore.
Okay. So may I suggest that it's also added onto the 2021 work plan?
Thank you.
And then there's also a question, conference, where will be this second conference? Is this the one in Morocco?
No, they are different.
I think
the
just
conference will be
the
online.
first Morocco. We have been discussing the second conference. I think we can let's make it maybe in the half of the year in June or in May or June. I think by that time, maybe the COVID pandemic will decrease, or maybe we hope it will give up with the vaccination. We hope so. I think let's open it not only to the Alliance, but we can invite speakers from other parts of the world, as the one we did with the Latin America and Asia.
Yes,
yes, a brilliant idea. Thank you, Professor Najib. Definitely, like I highlighted, it brings a lot of people onto the mix from various parts of the world to participate during the conference. Thank you for that, Professor Najib. And then I have a comment from Wale. He says, should the response be from medical point of view or from someone living with epilepsy? And their thoughts. If you look at the motto of the Alliance, we do not have, any level that you are a professional, you have epilepsy or you don't have epilepsy. We appreciate your comment and we would want to hear your comment, and you can participate from any point of view, regardless if it's medical, social, whatever. Please feel free to comment and give us your thoughts. I've answered you, Mwale. I suspect that you are from Malawi. Yes.
From Zambia.
Yeah. Oh, from Zambia. Okay, my apologies. And then there's another from Musimbi. COVID vaccine and epilepsy is such a good topic to consider. So it's something that we also need to look at in the next or in the webinars to come.
Maybe you could do a final round to ask people if
we
they've
now
got...
have someone from Sierra Leone. Oh yes. Thank you. Thank you for that. I just wanted to find out if Morocco or anyone from Burkina Faso, no, not Morocco, Sierra Leone or Burkina Faso are here, or they are on WhatsApp. They could just give us their comments so that it's captured in the report, and then we move to the next item on our agenda. And then, ladies and gentlemen, for the 2021 work plan, like I said, it's not cast in stone, but if you have any other ideas, please send them through via the Secretary General, who will then, send it to the executive for consideration, so that we make a very inclusive work plan for 2021. This will help us to make sure that we address all of the challenges that we currently have or we want to address. So maybe at this juncture, may I ask all the participants maybe to give some comments, and then we wind up our general meeting, our AGM. Maybe should I go according to the picture, the views that I see on my computer? According to alphabetical, Mr. Dumbo, would you want to say something? Would you want to say something? Your mic is switched off. You muted. We can't hear you.
Pardon? Okay. Oh, sorry.
Yes.
It's just coming, just in the middle. Oh, yeah. My name is Araújo Domingos. I'm from Mozambique, but I'm now talking from Sweden. I'm living in Sweden for some time. I'm studying here. That's why. But Mr. Roger told me about the meeting. So I had to join from here. That's why. Yeah. But since we are still a new association, most of things we have still to learn a bit about how it works. From other experience, you are somehow a bit advanced in so many things. So Roger told me just to join in, so as to hear and listen on, and also to learn about it. That's why I'm very grateful to take part in this conference. So, yeah, and I think from now we can just also participate in other conference coming on. So thank you very much.
Thank you,
Yes.
Mr. Domingo.
Yes.
Saying that we are also learning and we would want to participate. No, thank you. You are very much welcome, and hoping success in your studies in Sweden. And when you come back, let's hope you will help us to improve the landscape of Africa in terms of knowledge. Thank you. The next again would be
sorry, Mr. President, just to say that Mr. Araújo Domingos is the co-founder of our association. So we are together in founding this association. So I just want to say thank you very much. You have helped us to reach where we reached, although you have to leave to Sweden for the studies. So thank you very much.
Oh, thank you very much. You are most welcome. Yeah. Actually, yes.
Obrigado. Thank you.
Obrigado. Thank you.
Right. Madam Cindy?
Just to remind you about giving us your point of view, and also just to tell you that remarks we are waiting from your side about the paper are expected. So please give us your feedback. We are waiting for your contribution. And I think just to remind you, this is the map of all the countries I think we have in the alliance, but I think now we increased this representativity. So I hope that we can maybe send us, I think Chantal or maybe Dr. Jacob will send us the new members just to complete and to fill the other missing countries. I think we have Libya, we have Sudan. I think it will be very interesting to have many countries. I think, for example, we need Angola, we have Sudan, we need Chad also, Algeria, we have one new member, Tunisia, Mauritania here. So I think we can increase the number. And I think that's very helpful in fulfilling our initiatives in telemedicine and writing papers and making our alliance in top level.
Yes, thank you. I think from Southern Africa, there's Botswana. and I think in Angola, I think we'll discuss more about the end in Madagascar. No,
Yeah,
thank you.
also Madagascar. I have one contact in Madagascar. Dr. Julien, I think he could be also connected. We have also from Somalia, the neurologist of Somalia. I think we can cover all Africa.
Prof Najib, for Angola, I have some contactors, but it is in Portuguese. I don't know if it will be help for you, because I have some contactors of doctors who are there, but it is the Portuguese. I don't know if it will help you.
Yes, yeah, I think it will be very helpful to belong to the audience. Of course, it's our executive committee who will decide, and also to help us in having partners in collaboration and in doing research projects. And also, I think to involve people in the audience, that should be the first step. Then we can get them with us in writing papers, projects, and telemedicine and nurse program.
Perfect.
Thank you. Thank you to Mr. Prince. He's very active in his region. He got a lot of contacts from many countries.
Thank you, Prof.
Thanks.
Thank you, Professor Kitsan. Just to let the House know, the professor is very passionate about papers, and he also likes, input whenever he develops, including the rest of the executive. So if you are also interested and you do have a concept that you feel you might not have the technical expertise to write it, but share the idea with the professor or with Dr. Gumbate or our Secretary General, so that they can conceptualize, write it, and then develop. And obviously, in that paper, you will be recognized as also the generator or participant of that particular. And in most cases, this will go a long way in promoting and also your contribution towards your country, the region, and Africa. So I would also want to encourage you guys to, whenever you come up with any situation or a concept, please share, and definitely we'll make sure that we will support you from a professional or a technical point of view so that we produce a paper. The more papers we have, the more exposure and also recognition that we would get as the Epilepsy Alliance Africa. So I'm encouraging everyone to participate. Right. As I'm doing a round table, and now to maybe just to give us your point of view, so now then to move forward, any things that you feel we've left out. And also just, I forgot, are there other issues that you feel we need to adjust in Constitution? Are they specific? I know maybe it might be too late, but if there are anything, you can always write them and then send them to the Secretary General. Madam Musimbi, you're next.
Sorry, Mr. President, I just sent my final comments on message because I'm now in a noisy place. Kindly.
No, okay.
Otherwise, thank you so much.
No, thank you. That's noted. If you are not receiving emails, please send your emails. Right, I'm just being told that if you are not receiving the emails or the newsletters from the Alliance, please send your emails so that we are able then to put you in the database so that you regularly get formal communication, be it or newsletters or anything that would be happening. I will jump and then start from back to front. Iti Modetse, LE. Please give us your point of view. YT Modetse. I hope I pronounced it correct. You can unmute your mic, unmute your mic. Okay, maybe we can move to the next. Anastasia, your point of view, comments, suggestions? Hello, Anastasia, are you there? Okay, maybe they'll join us a bit. And then Demola Akano, could you give us your point of view? Okay, it seems as if everyone is there, but maybe because of network, maybe I think Madam Annette, you could give us your comments.
I'm sorry, it's quite noisy now, so I can't hear much right now.
Okay, I just want to say great job, everybody, because organizing something like this is not easy. I see a bright future. I see strength. I see hope. I see we come from all exposures and walks of life, and experience with our our own national whether country or continent experience, plus international as well. So there is hope for us, and let's work together. And I want to take this opportunity to thank you all, the executive committee, for the hard work you've done so far. And all the comments are not meant to criticize, but they're meant to help us grow even better and to be strong. So that is the spirit that comes from, I'm sure, from everyone, definitely from mine. And we're here to support you. We're here to grow together. And thank you for the hard work once again.
Thank you, Annette. Thank you. Wonderful. The person that you see, Hassan, is the technical guy behind most of these webinars, the YouTubes, and so forth. Maybe, can you just say hi to everyone, Mr. Hassan?
Yes, how are you? I am Hassan from Morocco. I am.
Hi, Hassan.
Hi, everybody. So I can show you my. I turn on my camera.
Hassan is a very active member of our association, and he's leading all activities.
I am in the
YouTube.
association.
See you, Hassan.
Hi, everybody.
Good
nice
to see
to
you.
meet you, all of you.
Yes. Thank you. This is the guy behind the hosting, the electronics, the technology, and so forth. Thank you for everything. Without this guy,
you are welcome. You are welcome.
Good job. Good job. Thank you.
He's our electronic man.
Yes. No, thank you. Anastasia, are you back now? Oh, Demetlo, you said that you are in a noisy place. And then Dr. Kazadi, any closing remarks or comments?
Okay, President, I think all is good. The plan for 2021, everything is good. I think we'll work in this way that is to bring more countries to Alliance. That is something myself I'll work to bring all the countries on my Africa Central in Alliance. I'll do that. And very soon, like Angola, because the barrier for me was only like the problems of the language. That is, it is allowed to bring like persons who are speaking Portuguese and everything, like every language. I think it will be good because French now is allowed, Gabon, somewhere Central African, every person is very it does. And I think in working like this, we'll do more this year, this 2021. Thank you to everyone. Thank you for the work. And I think everything will be very good with us. Thank you very much.
Merci, asante sana. Just for the reminder of everyone, we are also logged on YouTube and via WhatsApp. you could send your comments either via a voice note on WhatsApp on the group, or you could type so that we can share to everyone. And you can log on to even our website if there's need for any information. Before I move to the professor, Modesti, are you able to communicate with us? Anastasia or Akano, are you there? Okay. Professor, over to you.
Yes. Yes, so it's my pleasure to give these final words for closing session. And thank you very much, Mr. Kazviti, all the executive committee of the Alliance, all the members. So we are very, very proud of our Alliance. And as discussed by our colleague, I think with IBE and the other associations and institutions, I think we should collaborate. Of course, we are belonging to the Alliance. We will forever belong to the Alliance, whatever is the direction that we will take to be member of the executive committee of IBE or any other organism. But I think we should enhance our collaboration, and also we should get the feedback and the remarks from any other groups, because it could be just enhancing our power and our productivity. And I ask you to ask your nurses and members to join our educational program, which we'll plan in 1 or 2 weeks. And also I'm waiting for your remarks for the papers. As you saw, we have very nice paper from our Alliance. We put Salle as leading of that paper because she did never publish any paper, but we thank also the other members, Mr. Jacob, Chantal and Musimbi. We have also our colleague from Malawi, Shigamba, and also we have other partners that are writing papers for the African Middle East Epilepsy Journal. And thank you very much, and good luck and good long life to our Alliance.
Thank you. We are indebted to your support, Professor Najib.
It's my pleasure.
You've been a very strong pillar in terms of most of our webinars, and that technical support were very much appreciated. I noticed that Dr. Gwen Kandawashika, neuropediatrician, is just joined us. How are you? And maybe you could just give your expectation for 2021 in terms of epilepsy in Africa. Are you there, Dr. Kandawashika? Right. Well, she will come on board. I just received something from Bernard Muya. He says all Epilepsy Alliance members, due to network connection challenges, have not been able to join today's AGM meeting, but I would like to make my input on this platform, and I will appreciate if the executive will include it together with other opinions given on the floor. Having lived with epilepsy for 13 years now, and I have the following points to make. Most of us here are professionals who depend on the book knowledge about epilepsy effect on human life. But persons living with epilepsy have a feeling experiencing with epilepsy. Let us develop a policy where persons who have lived with epilepsy can be included in the decision-making forum levels of the organization, even if one needs to upgrade the level of education. Let us do it. It's going to make decisions that is going to really impact the lives of people with epilepsy, especially those living in the villages. And just a mention, most of the organizations are based in cities or urban centers. Living in rural areas too. That's why I decided to move to the village and establish myself there. BEAFK is a rural-based organization. I would like to appreciate the Alliance executive to design policies that focuses on working with organizations that are either based in the village or those that extend their work into rural areas where the real work is needed. Otherwise, I'll continue participating in the Epilepsy Alliance Africa activities and webinars as usual. Focus your effort on smaller organizations that are struggling without any substantive funding, more so the ones spearheaded by people with epilepsy. Long live Epilepsy Alliance Africa. That was from Bernard giving his input. Bernard, I think it's touched on a number of areas that we've discussed. And maybe this is also something that I've just read from his comments, that to what extent can we ask member chapters to talk about some of the activities that they are doing in towns and in rural areas? And that can also become a criteria even for awards. The focus is more, or the focus is also equal in rural areas as it is in urban areas. Because from even WHO, it says majority of people with epilepsy live in rural areas or in remote areas. So I think it's something that we will take home. Thank you, Bernard, for that wonderful presentation. We have captured it, and definitely it has been taken note of. And we definitely encourage, if you do know any organizations or even people with epilepsy that are in your area or in your country, please invite them to join the Alliance. We do not select on the level of education that you have. You have education or you don't. They say it takes two to tango. For there to be a diagnosis, there has to be the patient and the doctor. So without any of the two, there's not much we can talk about. But we are very grateful for the input, and bring more people on board as much as you can, regardless of where they are, be it rural or urban. Bring them on board, and definitely we'll come up with ways in which we could, address or communicate issues that are important. And then I got something from Dr. Gwen Kandawashika. I have poor internet connection. Thank you for the great meeting. It is my wish that the Alliance strengthens its community engagement, particularly hard to reach rural areas. Great work, everyone. Thank you, Dr. Kandawashika, for that. I think it's also has been discussed by Bernard. Thank you. We also have Alason Dravi. Would you want to comment or give us your input? I think it is still connecting. Do we have anyone who would want to make their comments before received and what we've discussed? And I would also want to request Dr. Mgumbati to give a summation of the key issues or take home.
Just I want to add one comment is that also we need to activate the task force about projects, about, of course, I'm in charge of papers, for example, about projects, as I mentioned. I don't know if you can work in small groups just to submit some projects. As I mentioned before, we need some funding for these projects to help the African countries, especially in rural areas. And I think we can get some budget from many sponsors. For example, I will share with you one call of funding. So it's dedicated to some few countries of Africa, but I think we can target these countries in each scope of any project.
Thank you, Professor Najib. I've got a comment from Dr. Watila. He says, well done for the good work, always ready to make contributions. Well done, Professor Najib. Yes, thank you. Yes, I totally agree with you, Professor Najib. If we do have guys that are good, in project proposals, please let's do share or forward them to the executive. I know that Professor has a good number of connections that could support some of the project proposals that you might develop from wherever region you are from. But we are very grateful. So Dr. Mgumbate, please could you give a rundown of the key areas we've discussed so far in this general meeting?
Of course, thank you very much. Enat from Ethiopia was also writing, so I was thinking maybe we could hear from Enat first, then I add what I have. Is there Enat still in the meeting?
Put in each project, I think we can submit. We have a lot of opportunities, and we can have big finance, and also that will help to increase the budget of the Alliance.
Definitely, yes. I'm not too sure if she's still in. I can't see her. Annette, are you still there? I think maybe it could be network challenges. I can't see her. Maybe you could just,
Okay.
give us.
Thank you. I'll go through what I have here in terms of comments and questions. If there's anything that I missed, please let me know so that I put that down. I'll just share, it's a slide. Okay, can you see it now?
Yes.
Okay, so that's what I noted, but like I said, Enat also noted because the secretary was not there. So startness workshops in March, you can confirm that, Professor Najib, then more fundraising required. We need to submit project proposals, then increasing members of the Alliance, then interregional conference, that's a conference attended by members from other continents. Then Ethiopia is happy to help organize the second Epilepsy Awareness Epilepsy Alliance Africa Conference. Then the next one, COVID-19 response for epilepsy in Africa is needed. Then for our 2021 calendar, we could send all members and give 7 days response for feedback. Then let us contribute to Epilepsy Alliance research projects and create partnerships and collaborations with organizations like the IBE, but we keep our independence. Our members asked to volunteer to join the executive and subcommittees. If there are any suggestions to improve the constitution, please send them to the secretary. Epilepsy Alliance Africa to focus also on organizations in rural areas. They are usually small and if their unique needs. Then let us develop a policy where persons who have lived with epilepsy can be included in the decision-making forums or levels of the organization. Then finally, let us make our committees active. So if there's anything that I left, please let me know so that I edit.
Yes, thank you. Thank you for the running down the points that have been highlighted in our meeting. Again, we are on WhatsApp and YouTube. You could send your comments via WhatsApp. You could also do a voice note so that we capture some of the issues or concerns that you might have. So Professor Najib and all the vice presidents here present, maybe your last remarks before I close the meeting. Hello?
Yes, did you say Professor Najib?
Yes.
Yes. I was saying that maybe final comments to all the vice presidents that are here present. I mean, here present before we conclude the AGM.
Who's going to address that? Who's going to say something? Is it me or Professor Najib or the Vice President?
Professor Najib, Dr. Gizadi,
maybe I can say just a few words. Maybe I can.
Okay.
Just words, and I ask everyone just to accomplish our objectives and also to finalize our papers and our projects. For example, I think I have one small suggestion is in French. I suggest maybe to share it with all the colleagues, the African colleagues, and we can, by example, put it in, also put on our website, maybe.
Okay. Thank you, Professor Najib. Dr. Gizadi.
Thank you very much. Thank you, everyone. I think all the point was already treated, and we want to work once again. And I think everything will be very better. Every programs for this year are very okay, and we do all our best to do together. And the new member on the committee like Musimbi and everyone, I think together we'll do more. Thank you very much. Thank you for the time. Thank you, President. Thank you, everyone.
Thank you. So I think those are the only two vice presidents that are here present, correct? Right.
Okay, I think so.
Right. Would you want to do the closing remarks and then, or I do them?
You or the Secretary General?
Okay. Unfortunately, she's offline. But nevertheless, ladies and gentlemen, the vice presidents from the 5 regions of Africa, I would like, and the Secretary General, the executive member, and the new kid on the block, Musimbi, I'd like to express my sincere gratitude for coming to this annual general meeting, and all the contributions that have been made by chapters, individuals, professionals, and also most importantly, sharing that common cause of us being an African, and yet also this being a Pan-African organization to ameliorate and improve the quality of life for people with epilepsy. We are very grateful for all the technical support we've been getting from the University of Marrakesh, Professor Najib and company, in particular mention Mr. Hassan has been an asset since day one. He has been the man behind the scenes in making sure that we communicate from the various places we are in Africa, you know, from north to south, east to west. We are very grateful for all that support, and your technical team that has been facilitating these webinars and other meetings that we've had. We're very grateful. I still remember the Professor Najib supported our National Epilepsy Week of last year by having his organization hosting the webinar. And I think maybe you might, if you so wish, you might kindly ask him and maybe he might support you. So thank you, Professor. We are indebted to the support you have given us for all this period. I'm not too sure what would have happened if some of your staff and yourself were not there. And also the professionals that we have who have contributed immensely. We are very grateful for all the support you have been giving. I know some are in Africa and some are not, and those that are outside continue to support activities and workshops back home here in Africa. And we are very and truly grateful. Look into 2021. The pandemic has ravaged the whole of Africa, and not only Africa, but the rest of the world. And we need to make sure that in our campaigns, we include awareness on the COVID-19. It's real and it's killing. And measures to prevent and manage the disease is important to us and to all our members here in Africa. We have the issue of the telemedicine. I think this is the new approach in terms of addressing the shortages of professionals and human resources we have in Africa. I would like to encourage all countries to at least nominate 1 or 2 nurses in their respective countries and in support of a few doctors within the same country, and liaise with Professor Najib, where real-time consultancy can be given with a very little support or financial support, where only what is required is the connection. I think this is the way to move in addressing the shortages of professionals we have, and this can be utilized to mitigate or at least manage the gap that we currently have. Our primary goal is to reduce the treatment gap between those that are on treatment and those that are not. And again, the challenge of the myths and misconceptions that surrounds epilepsy, we wish to continue awareness programs in Africa and in our country's regions. We want those to continue. Again, the issue of encouraging other members to participate. I would like to reiterate this again, repeat this. The Alliance has an open door policy. Anyone from anywhere can become a member of the Alliance, regardless of your education, regardless of where you come from, which language or which region you come from. You are most welcome. This is a Pan-African organization where we want everyone to be part of this organization and help us build a resilient and an organization that accommodates everyone. So everyone is welcome. Your participation is really important. So let me thank you, my executive team. You have been wonderful. You have been amazing. Professor Najib, Dr. Mgumbate, the Vice Presidents, the Secretary General. Please continue the good work. Musimbi, we continue to notice. Remember, ladies and gentlemen, we continue. We will be monitoring you day in, day out, your reports, your activities, and so forth. We have other means of following up. So some of the selections are not because we favor, but it's based on performance and based on evidence. So you can call off any name, and I can tell you here now that we've got evidence to show that they've performed to expectation. So without much further ado, I wish you a 2021 success in implementing all your programs at community level, at your organization, at chapter level, and national, regional, and continental. Last but not least, the presidents, please, the vice presidents, let's unite those regions. Let's invite those who are not invited. Encourage all the countries to increase or invite more members to participate. If you need help, please tell us, and we'll make sure that we will put our other extra connections to make sure that you increase the numbers in your region. So without much further ado, ladies and gentlemen, I thank you, and I wish you the best of luck, and God bless you. Asante, merci, asante sana, and merci.
Thank you very much, Mr. President, for your closing remarks. You haven't declared the meeting closed.
Yeah, thank you very much.
So
thank you, everyone. Bye. Thank you.
Ah, we forgot the picture.
Yeah, we forgot the picture. So let's switch on our camera.
Can we switch on our mics?
Yeah.
I guess we'll just have to do it.
Who's taking the picture? You, Professor Najib?
Mr. Hassan, can you take us a picture?
Okay.
Hassan, I think our specialist.
Okay.
Yes, our specialist IT doctor.
my professor.
Oh, Professor.
Teach me to be technical.
Mr. Hassan is very dynamic person. But I think also Jacob, Chantal, and all the other members.
It's okay for the picture.
Okay, thank you. So, ladies and gentlemen, stay safe.
Bye.
God bless and your families. Bye-bye.
Bye.
And then those that were joining via YouTube and WhatsApp, thank you and God bless. Remember to input via the WhatsApp and the email to the Secretary General. Thank you and God bless you all.